morning everyone. I am going to present my thesis on comparison of ganglion cell layer thickness on optical coherence tomography and waveforms on pattern electron among glaucoma suspect and healthy controls. So, as you all know, glaucoma is characterized by chronic progressive optic neuropathy resulting in characteristic visual field loss, and the prevalence is being 3.54% worldwide and 2.3 to 4.7% in India. By 2040, it will be around 111.8 million cases. And all know standard optometric perimetry is being the gold standard for glaucoma detection, but it requires at least 25% of RGC loss to be detected. So for the pre-perimetric glaucoma cases can be assessed structurally by OCT and functionally by pattern ERG. So rationality behind our study, as these OCT and PRG are the non-invasive and objective method, and it will help in early assessment of developing glaucoma. So to novelty is to our best knowledge, no such study has been taken on the ganglion cell layer thickness alone and compared it at different locations like 3 millimeter, 3.45 millimeter and 6 millimeter in macular region, and very few studies as compared by PRG parameters among glaucoma suspect and healthy controls. So we expected that there will be decrease in GCL thickness and increase in implicit time and decrease in amplitude of pattern ERG waves, and which can be utilized to prevent the progression of the disease earlier. So our aim was to evaluate the difference in the above said parameters between the two groups, and the objective was to measure the thickness of GCL and OCT on OCT and implicit time on amplitude of P50 and N95 waves on pattern ERG. So our study design was cross-sectional observational study on in AIIMS Patna, and we included subjects of 40 to 60 years of age with suspicious optic disc comprising of more than vertical scope disc ratio more than equal to 0.5, or there may be diffuse or focal narrowing, disc hemorrhage, or asymmetric appearance of optic disc of more than 0.2 between the fellow eye. And subject with the normal finding, we have taken as control group and excluded the known cases of glaucoma, any cases of angle closure, IOP more than 21 millimeter mercury, more than 4 diopter, and having any visual field defect and coexisting any retinal disease and medial opacity. And with the following assumption, we have calculated the sample size to be around 25 in each group, but we have taken more number of patients, 50 in each group. And after comprehensive evaluation with high IOP and angle closure cases, we have excluded all those cases who have the visual field defect, and then further proceeded for proceeding. And these are the pictures of our own patients, and these are the pattern ERG waveform of our patient. Coming to the statistical analysis, we have analyzed the data on Jamobi software, and p-value of less than 0.05 was taken into consideration. And we found that there was significant difference between the control and suspicious disk group at 3.45 millimeter and 6 millimeter. And for the P50 wave, there was significant difference in P50 amplitude and implicit time, but for the N95 wave, we didn't find any significant difference for the amplitude, but significant difference was noted for the implicit time. So for the OCT on discussion, our finding was similar to Zhong et al. And Zhong et al., but they have taken the GCIPL thickness into consideration. And for the P50 wave, we have similar finding in comparing to Jion et al. But the Zhong et al. Have decrease in amplitude of P50. Benkel et al. Have no significant change. And for the N95 wave, we have found the similar finding to the Zhong et al. But Zhong et al., Benkel et al. And Jion et al. Have significant decrease in N95 amplitude, but we did not find any significant change. So our limitation was small sample size, hospital-based cross-sectional, and corneal electrode. Conclusion: the basis of morphology optic disc, structural functional assessment can be done, and thickness analysis of GCL alone can also help, and pattern ERG findings can be detected on for the glaucoma suspect patients.
Yeah. Thank you, judges.
Was the control was selected from the OPD or from glaucoma clinic?
So controls are all selected from the OPD. They are as the patients are registering, we are consecutively selecting the patients.
Okay. And what were the whether MRW and RNFL was also studied, or?
So it was taken on the OCD machine, but we have not taken those parameters into our consideration.
I think you mentioned in your slides in the beginning that no study has been done. But then in the discussion, you mentioned couple of studies. So what's the difference between your study and the other studies?
Previous studies have taken GC IPL thickness and GCC into consideration, but we have taken only the ganglion cell layer thickness and also at different location like 3 millimeter, 3.45 millimeter, and 6 millimeter.
Which machine are you using?
Heidelberg HRS spectralis, OCD spectralis.
Okay. So why didn't you take the glaucoma patients for comparison? You could have taken them also.
Yes, the previous studies have shown that we are comparing glaucoma suspects and controls. Previous studies have been there comparing glaucoma suspects and early glaucoma and established glaucoma cases. So we want to know whether there are changes is present also in glaucoma suspects or not in comparing to controls, so that we can assess them earlier and we can prevent the disease before.
No, how do you know these are glaucoma suspects? They may as well be glaucoma patients, because by your criteria, if you do visual fields and if that is positive, they may be glaucoma patients.
No, sir. Though on visual field analysis, the patients, the subjects who who do not have any perimetric changes, we have taken them into. Yes.
Excluded them.
Yes, sir.